Okay, I show us at 2:03, so we might get a couple other folks connecting on here. I'm glad to see the two Lyns from the east and west side are connecting, and others are making connections in the chat. My name is Richard Von Glahn. I am the Policy Director for Missouri Jobs with Justice, and I'm going to help lead and facilitate this important conversation today. So this is the third webinar in 2021 from Jobs with Justice. Thank you to folks who joined us for the first two, where we discussed many items of importance to Jobs with Justice this legislative session. But today we are really going to focus on just one that's getting a lot of attention and is critically important right now. And that is the issue of Medicaid expansion. Thanks to many of your efforts, voters made Missouri the 38th state, plus the District of Columbia, to expand Medicaid last August when we passed Amendment 2. But as we at Jobs with Justice especially know all too well, the will of voters means little to some members of our legislature, with one boldly proclaiming 2 weeks ago that he was proud to stand against the will of Missouri voters. We are going to dig into the debate around Medicaid, what failing to expand as the voters desired might cost us, and what we can still do about it in a minute. But first, I want to offer a few reminders to those of us new to joining us here on Zoom. A few tips about the webinar and using Zoom. With so many people on the call, we are going to place people on mute, and you're only going to be able to see the speakers by video. If you are on a computer, please use the Q&A button at the bottom to ask questions about the presentation. We expect and it's totally fine that there could be many questions for this webinar. And so we will answer some as we go along and open it up at the end to make sure we can answer everybody's question as to the best we can. But it really helps us if you put the questions in the Q&A and not in the chat. But please do use the chat function to make comments or flag any issues, or as many clear veterans of the program here are doing, use it as a chance to do introductions and connect with one another all across the state. We really like doing these webinars because it gives a chance from people from Kirkwood to Caruthersville to St. Joseph to down in Joplin to all connect with one another. We are also going to have several staff members in the chat who are happy to connect and work with any technical issues if things come up. We are going to provide all of the links that we will have at the end about ways to take action in a follow-up email. So don't worry about scrambling to type anything or write anything down. Those will be sent to you. You will also, of course, get the contact information for all of our organizers, so you can reach out back to them if you have questions or need for follow-up. Jobs with Justice Voter Action is a coalition of labor, community, faith, and student groups, as well as individual activists who care about building an economy and a democracy that work for all of us. As part of that, and in coalition with others, we've drafted the following statement of principles that we like to read before each of our meetings. We are a collaboration of grassroots organizations that believe in the innate dignity, worth, and power of all people. We work to support the leadership of historically oppressed people and oppose dehumanizing narratives of white supremacy and domination. We are dedicated to creating a new narrative of mutual thriving and modeling the just world we want to create, both within and between organizations and each other. Okay, so we're going to go ahead and get started. And we're going to start in a little time machine. And some of us, you might even see pictures of yourselves and you can say, look how wonderful I looked 10 years ago. And that's a brief reminder about what Amendment 2 was and what it did. We spent nearly 10 years of doing marches, doing meetings, doing petitions, doing thousands of phone calls, lobby days, in-district meetings with the legislator, everything that we could do to really move Medicaid expansion forward. You can see photos of our actions through the years here on the screen. But ultimately, that never worked. Amendment 2 was the people's solution to our broken politics. It was a constitutional amendment that was placed on the ballot through the submission of nearly 350,000 signatures from all across the state, many gathered by all of you on this phone call. Originally slated for the November 2020 ballot, it was actually moved to the August ballot by Governor Parsons. And so when August came along, Amendment 2 passed, and it wasn't really that close. We passed with an over 6.5% margin of victory, making Missouri the 38th state to expand Medicaid eligibility and the 6th to actually do so via a citizen ballot initiative. Our neighbors in Oklahoma had done it right before us in June of 2020. Knowing our legislature was perhaps more hostile to the Medicaid program than our friends and neighbors were, Amendment 2, as I mentioned, was crafted as a constitutional amendment, meaning that the legislature cannot simply repeal it without a subsequent vote of the people. And part of that amendment is clear. It means that eligibility for Medicaid, currently some of the lowest allowable by federal law, is going up on July 1st, 2021. That is in our state constitution. Before we get into what the legislature is doing about this, I actually want to invite Alice Nelms to speak briefly about what Amendment 2 really means to her and to her future and what's at stake. So Alice, you should be unmuted.
Hey everyone, I'm Alice. I'm joining from the Independence area, and I'll just start by talking a little bit about myself and my situation. I work in a nonprofit in a role that's a fixed term, so my job stability right now is really up in the air, and I could actually end up losing my job on June 30th, the day before Medicaid expansion is supposed to be instated. So it really depends on whether the program I work in gets more funding. So I really don't have a whole lot of control over the situation, and it's stressful to not know whether I'm going to have a job in 2 months. And then on top of that, to not know if I'm going to have health insurance once my employer's health insurance is gone. And without Medicaid expansion, there is no safety net for me to be able to access health insurance, and I will be uninsured. And I have health conditions that are totally manageable if I have access to care. But without care, they could worsen and become more serious issues for me. And some of them were, in fact, issues to begin with because I lacked access to medical care when I lived in a rural community on the border of Iowa and Missouri. And there wasn't a doctor or a dentist nearby. So I wasn't able to go to the dentist except for once, and developed a gum condition because of it. And from living up there, I see the ways that the lack of health insurance health insurance, yes, but also healthcare facilities, and the living in an area where facilities are maybe 30 minutes or even an hour away, that impacts these communities in so many ways, both in terms of health and economic stability. And so those are reasons why passing Medicaid or keeping Medicaid expansion, preventing it from being overturned, are really important to me, because we all deserve to be able to access healthcare, regardless of how small or big our health concerns are, and regardless of where we live in the state.
Thank you, Alice. I really appreciate the reminder that Medicaid is just not numbers on a spreadsheet or anything else, but it's the true stories like yours. And I see in the chat, Heather, one of our activists from sort of rural southeastern part of the state down in the Boot Hill. And that just reminds us whether we're talking about rural southeast Missouri, rural northwest Missouri, and anywhere and everywhere in between, just the impact that this is going to have. And we are really committed, and we're here today to make sure that when July 1st comes around and, you know, if your grant runs out and if things happen, that the safety net that, like you said, all Missourians deserve is there and ready for you, and that you can have the care and access to support that you need. But unfortunately, you know, our victory at the ballot box and the needs of people like Alice and an estimated 250,000 more Missourians that would be provided coverage through Medicaid expansion hasn't stopped some members of the legislature from prioritizing politics over policy and making, frankly, irresponsible decisions about moving forward. I mentioned in my intro, the one representative who is highlighted here, State Representative Justin Hill, and his quote, even though his constituents voted for this, that he was proud to stand against the will of the people. And what he is really referencing is a vote that was taken about 2 weeks ago, where the state house is seeking to defund Medicaid expansion through a budgetary cut, a cut to the budget of Medicaid in order to block people like Alice from getting care. Now, when we start talking about the budget and budget matters, there's frankly no smarter organization in Missouri on matters of the budget than our good friends at the Missouri Budget Project. Like Jobs with Justice, they have been championing the expansion of Medicaid for years because it frankly just makes so much sense, not just from a human perspective, like Alice talks about, but also from a budget perspective and the bottom line for the state of Missouri. And so, you know, to explain how how foolish and irresponsible the legislature is being and seeking to use budget concerns to justify cutting Medicaid, I want to invite our friend Amy Bluen, president of the Missouri Budget Project, to help us really enlighten us in just what's at stake and how Medicaid expansion is going to impact Missouri's budget.
Thanks, Richard. Hi, everybody. I hope you're all doing well. So as Richard said, you know, the debate in the legislature right now is solely focused really on the budget and whether or not the budget is going to include the funds to support Medicaid expansion. The governor included the funding in his budget request. The House removed it, and the Senate Appropriations Committee is now considering it. What lawmakers said in the House is that, you know, the state couldn't afford Medicaid expansion. But what we know from the experience of other states that have expanded, the 37 states that expanded before us, is that in each of those states, they saw decreased costs to the state when Medicaid was expanded, and they saw increased state revenue. And you all know this, so I'll just summarize it really briefly. But, you know, the states already spend state revenue, state tax revenue on services for folks who are uninsured. We fund things like mental health. healthcare services in the corrections department, other costs that are borne either entirely by the state or with a larger portion of state money than federal funds. As Medicaid expansion is implemented, what happens in the states is they can decrease state costs as more people enroll in the program, which is largely federally funded. So decrease state tax dollars going into Medicaid and increase federal tax dollars going into Medicaid. We know that, for instance, in Missouri, we will leverage about $1.7 billion in federal funds each year to support Medicaid expansion. What that means is we'll have an infusion of federal funds going into the healthcare industry and ancillary industries, and that supports jobs. We know that research has been done in Missouri indicating that a significant number of jobs will be supported, so much so that we will increase personal income in the state by $545 million in the first year alone. So that increase in personal income means that we'll have increased tax revenue. People with incomes, are more likely to obviously pay income tax and pay sales tax when they spend their incomes in the local community. That will result in increased tax revenue, and this has happened in every state that has expanded, where they've seen the decreased cost to the state and increased revenue simultaneously. So it is a good deal already because of that. It's a good deal for the state budget because of those dynamics. On the next slide, you can see that it's become an even better deal for us because of the American Rescue Plan. The Congress passed the American Rescue Plan just a couple of weeks ago. It provides a new incentive for states to expand, who have not yet expanded Medicaid, to expand Medicaid, and it's a financial incentive. That financial incentive will increase the matching rate, the federal funds provided for Medicaid, for our current Medicaid program by 5% over a 2-year period. That equates with about $1 billion for the state of Missouri over 2 years. So while Medicaid expansion will cost the state about $130 million in the first year without taking into account any of those savings, the $130 million is well paid for, by the additional federal funds that will come to the state. So we are encouraging everybody to just push through the negative talking points that are happening or coming out of the Capitol and really help lawmakers understand that there's significant support in the community to expand Medicaid. And I know Jobs with Justice is doing tremendous work around that, working with all of you to get that message across. So I'll turn it back to you, Richard.
Great. Thank you, Amy. So, what's important is that we remember, from stories like Alice's, the human impact here, and then that we remember from the facts that Amy really provides us with, that we not get disorganized by opponents who, seek to mislead and say things that are not true. What is really true is all of our neighbors like Alice are depending on this, and Missouri has more than enough funding to be able to do this and meet the needs of all of our neighbors about this. So I saw a couple of questions that I want to try to address before we get started. I see one question of what is the status of the funding for Medicaid as of today in Missouri? So the current status of Medicaid expansion or funding of Medicaid is eligibility is still set to go up on July 1st. The current eligibility levels should all go up to the rate as part of the Affordable Care Act to 138%, that should happen on July 1st. The state has filed what is called a state plan amendment indicating their intention to begin enrolling people on July 1st to that eligibility level. Now, the House passed a budget that they know does not contain enough funding to provide coverage to all of the existing population as well as the expanded population. That is different from the governor requested a budget that would include funding for expansion, but the House did not pass that. This week, this very moment, actually, the Senate Budget Committee is meeting and debating the budgets that they will that they will then vote on as a full Senate, likely early next week on this. So you have the governor has requested one budget. The House has passed a budget that did not include all of the funding that would be necessary. And now the Senate is debating it. But with all of those budget items, there's also the fact that currently eligibility is set to go up on July 1st. Hopefully that answered that question, or if there are others, I'm sure we can follow up on that. I see another question from Laura. Today's resignation of Randall Williams has any relevance, impact on Medicaid expansion? Randall Williams is the director of the Department of Health and Senior Services. I'll be honest, Laura, I hadn't heard that yet today, but that is one of the departments that funding for Medicaid expansion is very important to. But I don't want to speculate as to whether or not his resignation had anything to do with that or not. There's a question of if the amount is not budgeted, what path is available for Missouri? So that is partially the unknown in Missouri, is if eligibility goes up, what happens if enough money isn't provided? There is a process in which supplemental budgets can be voted on and approved if it is during a fiscal year in which the state runs out of money for a program. I would expect there would potentially be a lawsuit as to whether or not the state has to provide funding at different levels, but that is really, for whoever was asking that question, that is the heart of the question is, well, what's going to happen if we don't do this? And we know the easiest path forward, the most responsible path forward, is for legislators to provide the funding and remove that risk from Alice and all others who might need services and be able to get services for this. And that sort of brings us to the point of what we all need to be doing right now in taking action on this. So I'm actually going to talk about the second bullet point you see on your screen first, the Senate Budget Committee. This is the group that is working on Medicaid expansion first. And we want to make sure that we encourage them. We do not want to send emails necessarily attacking them for not doing something. We want to remind them, as we did with the public in the buildup to the passage of Amendment 2. This is the right and moral thing to do for people like Alice and the 250,000 Missourians who will get access to critical care. It is the financially prudent thing to do, as Amy mentioned, in the federal money that will come into Missouri, the jobs that will be created, the healthcare infrastructure that will be strengthened, particularly in rural areas, as Alice and Heather spoke about. There have been 14 hospitals that have either, or healthcare providers that have either closed or cut services due to not having expanded Medicaid and difficult budget situations, expanding Medicaid would help restore those services and strengthen services. And so we want to remind legislators that this is the right thing to do by our neighbors. This is the thing Missouri voters voted for and put in our Constitution, and that it is the financially responsible action to take and help build up the infrastructure of our state. So we want to email the Senate committee, the Senate Appropriations Committee. We don't want to delay on that. We expect this debate on the committee will likely be done potentially by Thursday or Friday of this week. We want everyone to also email your own senator. Senators like hearing from their constituents first and foremost, and encourage them. I saw some of the chat earlier about hearing back from Senator Arthur or others about her desire to fight for funding for Medicaid expansion in the budget. And then most importantly and urgent right now is sign up to phone bank with Jobs with Justice. And we are going to be phone banking each of the next 3 Tuesdays, including tonight. I think we have over 30 people prepared to put some calls out to other voters in Missouri and to remind them what's at stake and encourage them to contact their senators as well. There are a couple key senators on the budget committee that we want to make sure are hearing from their constituents. And so Jobs with Justice is going to be doing that on Tuesdays. If you're not able to do them on Tuesdays, I believe MCU is doing this on Wednesdays. And then I believe Planned Parenthood and AARP are going to be doing these on Thursdays. So we're all going to pick up and do our part to make sure that senators hear from us and from their constituents, but we need your help to do that. So please sign up. It is not too late to sign up for tonight once you know that what's at stake here, and help us move forward. And then finally, as we always talk about, becoming a member of Jobs with Justice, helping make sure that organizations like ours are always prepared and ready and have the resources that we can move quickly and decisively to make sure that our vote is respected and that our neighbors get the support that we need. So if you are not already a member, I strongly encourage you to become a member so that we have the resources needed to move forward. I see there's a couple questions in the Q&A, so I want to make sure we address these. It looks like the first 2 are from Stan. How can voters' education get improved regarding the 14 rural hospitals, clinics closing? You know who's very clear about the impact of those closures is the voters in those communities. And so that's some of the communities that we're going to be reaching out to in our phone calls and making sure that those senators are reminded about the impact of those closures. How can voters learn that these legislators are violating our rights on taxpayer dollars? It is disappointing that the legislature seems to have a proclivity to ignore the desires of Missouri voters. We actually did some polling about this question a couple weeks ago, and 80% of Missouri voters said that the legislature should not repeal or block or impede issues that are passed by the Missouri voters through the ballot initiative process. Even voters that didn't agree with the ballot initiative process or with the issue that was on the ballot, if the people of the state vote for it, voters agree that it should be implemented and moving forward. Are phone calls and individual emails more effective than the JWJ link email? all ways of contact are effective. If you have an individual relationship with a senator, and you want to send a handwritten note, or a note via carrier pigeon, or anything else, feel free to do so. We try to provide the JWJ link to try to make it easier for people to be able to participate and do it. But sending individual emails and phone calls is certainly very effective as well. It's also really important that people sign up to phone bank with us, and help us connect with other voters in connecting here. Stanley's asking, does coalition work with other coalition partners? Certainly that's true. That's the work that we're doing with MCU and with Planned Parenthood and AARP and the broad coalition that helped pass Amendment 2 to begin with. Julie S. from Springfield asked a question I'm going to ask you to respond to, Amy. Is there any common tool, process, or taxation method that any or most of the 37 states use to facilitate the implementation of expansion?
Well, the states did not need a taxation method because, again, they all saved money. So they all were able to reduce existing costs that they provide for healthcare services, and use those savings then to support Medicaid expansion. Missouri would do the same thing, that we would use those savings to support Medicaid expansion.
So that's part of, I was describing this yesterday, actually for a radio program for MCU. Part of what Medicaid expansion does is it grows the pie of the state budget by creating thousands of jobs. There's thousands of people who are then paying income taxes, and there's thousands of people who then have money to spend and sales taxes and other things that further generate revenue in the state. So that is the way in which Medicaid expansion doesn't actually require a tax increase or change. It actually just grows the pie of the state budget in the process. It looks like there's some questions about letters of support from current or former legislators or from other organizations, Jobs with Justice, Empower Missouri. So there's a broad coalition of over 200 organizations that helped pass Amendment 2 to begin with. A lot of them are working very hard to make sure that our voice is respected. That includes groups like Jobs with Justice and Empower and Metropolitan Congregations United and Missouri Faith Voices and others. It includes groups like the Missouri Hospital Association, the Missouri Chamber of Commerce. Just last week, the Missouri Catholic Conference, weighed in on their continued support for the expansion of Medicaid. So it is a very broad and both bipartisan or nonpartisan list of organizations that are fighting for this. Lots of groups like the American Cancer Society and many groups that work to cure disease and illness have collectively been weighing in on this and to really support this. And that includes, Stan, to your question, some letters of support from mayors and municipalities and former legislators who are all really weighing in on this issue. Carlton, I see there's a question whether the legal paths to follow regarding Medicaid expansion. So the expansion of eligibility is in our Constitution for July 1st. And so that is currently planned that eligibility would go up, that the state is planning to do that. Now, if the legislature doesn't fund expansion, the governor could switch courses and say, well, without a specific appropriation, we're no longer going to fund expansion, and change things. I imagine that would result in the lawsuit of that the Constitution is not being followed. What we know as organizers and as activists, the last place that we want to be, the last place we want Alice to be when she's worried about a transition from a job is with Medicaid expansion in a court case. You know, courts are not great places for people who are facing uncertainty in doing different things. And so we want to make sure that we do everything to make sure that the legislature makes the right decision, and we don't have to rely on legal analyses and court decisions to move this forward. That doesn't provide Missourians the support that they need. I see a question. Did our calls seem to have an impact last week in moving the target? Who are we targeting this week? The answer to that question is yes. Last week, I believe we were calling Senator Searpoy from Kansas City. He is on the Appropriations Committee. You know, we never know quite where everybody is until they vote, but we believe Senator Searpoy is going to be supportive of the governor's budget and funding Medicaid expansion. So this week we are moving and we are calling Senator Esslinger, who is from Southern Missouri, the sort of southern middle part of the state. She is a district that has seen some hospitals and providers restrict services or close. And so we are going to be calling her to make sure that she's prepared to support this, you know, to support this budget and get this done correctly. I see a question from Janelle. Can legislators utilize the type of healthcare that the majority of their constituents have? You know, for some legislators, the type of healthcare that the majority of their constituents might have might be no healthcare. We want to make sure that we're always lifting everybody up and providing everybody, whether they're a legislator, whether they're you know, whether they're just a Missouri voter or anybody else. We want to make sure that we're lifting everybody up and providing everybody with the health care that they need to live a full and healthy life. I see a question from Julia. What moral authority, if any, do our legislators attempt to use to justify overturning the will of the people on this issue? It is an interesting question. I would remind people the motto of the state of Missouri is the welfare of the people shall be the supreme law. You know, I don't know that legislators are claiming any particular moral authority on this issue. Is you know, they're claiming you know, Representative Hill certainly spoke about that he didn't think Missouri voters understood what they were voting for. And so, you know, they understood who they were voting for, apparently, when they voted for him, but they didn't understand what they were voting for when they voted for Amendment 2. But I guess in his eyes, fortunately for them, he's there to save them from themselves. That's not an idea that we subscribe to. We think Missouri voters are very smart, and this debate has been had and resolved in the state of Missouri, and we just need to move forward with what the Missouri voters asked for. Any other questions from anybody? Okay, so I know that this is going to move very quickly in the coming weeks. The budget is supposed to be done by May 7th, and then the legislative session ends on May 14th. So things are going to move really, really fast. And we know that there are likely to be press headlines about Medicaid expansion, and the rumor mill will probably be moving at 1,000%. And, you know, it's really in times like that that our communities need our leadership, the voice and the leadership of organizations like Jobs with Justice, our allies at the Missouri Budget Project, and others to help both provide clarity about what legislators are saying, or clarity about perhaps why legislators are incorrect in what they are saying, and also provide opportunity and opportunities for action so that people can come together and use the power that they have to make sure that we get the right result. And so as things continue to develop, I want to encourage people to please follow us on Facebook. We are at Missouri Jobs with Justice. You can follow us on Twitter at MOJWJ, and you can follow us on Instagram at Missouri JWJ. I really want to appreciate Alice Nelms for sharing her story, and you know, we will be there for you, Alice, and making sure you get the result that you deserve. And Amy Bluen for, as always, providing expert analysis and expertise about just how beneficial Medicaid expansion will be. And of course, I always want to thank all of our activists who don't just join these webinars, but as I said, I think 31 people have already signed up for the phone bank tonight. So I'm hopeful with over 50 people on this call that maybe we can get all the way up to 40 and have a great impact again this week, just as we did last week. Please keep an eye out. You will get an email today with links to all of our action steps. And you can always contact any of your local organizers that you see up on the screen now. With any questions or ideas or need for follow-up. I saw some of the chat asking for specific talking points, and you can follow up with any of those organizers, or if it's on talking points, you can email me, richard@mojwj.org, and we'll make sure we can get you what you need to be effective. I see a question from Karen: when will we receive the recording? That takes some time to be able to download from Zoom, but we will get that posted as quickly as we can. So thank you again to everyone for joining. I hope everyone can continue to stay safe. We appreciate your attention and your action to this matter, and we will move forward hopefully together, and in 3 or 4 weeks, hopefully we can have a webinar where we celebrate the tremendous success of everyone this legislative session. Thank you all.